adding on to my partner's speech, and including and adding on to our policy, which said the U.S. should restrict access to abortion to the first trimester of pregnancy. That going on to our first claim, that abortion after the first trimester is murder. Dr. Meyer states that the first essential requirement for non-conception is the presence of sensory receptors, which first develop in the first parietal area at approximately 7 weeks gestation and are diffusely located throughout the body by 14 weeks. So what this is talking about is that if a fetus develops pain receptors or sensory receptors by 7 weeks and is located throughout the body by 14 weeks. So whatever happens to the fetus, it will feel anything that happens to it at that time. Dr. Johnson also states that Dr. Johnson states that abortions performed after 20 weeks gestation are most commonly performed by dilation and evacuation, also known as D&E procedures, as what Karen was talking about. Is a vacuum procedure. This particularly gruesome, which goes on. Dr. Johnson also goes on to state that these particularly gruesome surgical techniques involve crushing, dismemberment, and removal of a fetal body from the woman's uterus, mere weeks before or even after the fetus reaches a developmental age of potential viability outside the mother. And going on to viability means that it can go that the fetus can live outside the mother if she chooses not to have the baby herself. Dr. Johnson also states that previous studies of the late-term abortion patients have confirmed that most late-term abortions are performed because of a delayed pregnancy diagnosis and for reasons similar to those given to those by first trimester patients, and those reasons are financial stressors, relationship problems, education concerns, or parenting challenges. So women who have late-term abortions are also give the reasons first trimester women do for having an abortion. Going on to our second claim, costs are higher after the first trimester. Clinic Women's Health Center in Colorado states that early abortions require less care and follow-up and are significantly more affordable than later abortions. So what they're stating here is that it is less maintenance than what later abortions do have to do, and then there's less follow-ups than what later abortions do. Rockville Women's Center also gives an approximate cost on all three trimesters, in which the first trimester first trimester abortions cost up to about $300 to $950. Second trimester abortions cost from $1,200 to $2,100, and the third trimester are quoted individually, but are reported to be in excess of $5,000. And these are most of these cases are out of pocket because the later abortion because of this. The laterabortion.org states that the Hyde Amendment, enacted in 1967, prohibits federal funds from being used to cover an abortion. Cover an abortion. So women who have public health insurance cannot use that insurance to cover their abortion costs because of this amendment. Dr. Selganoff states that the issue of abortion coverage was at the heart of many debates in the run-up of the passage of the ACA, which is the Affordable Care Act, and which subsequently led to the renewal of the legislative efforts at the state level to limit coverage of abortion, and this time the private insurances. So what this means is that women can use outside insurance health coverages. Going on to our last claim is that medical risk. There are medical risks to late-term abortions. RamaInternational.org states possible side effects of abortion risk from the D&E abortion, which states that there's a hole in the uterus, that there could be a hole in the uterus, other damage to the uterus, injury to the bowel or bladder, complications from anesthesia such as respiratory, nausea, vomiting, headaches or drug reactions, the inability to get pregnant due to infection or complication from an operation, a possible hysterectomy as a result of injury during the procedure. So not only does this affect the fetus, that it can also harm the woman's body. And adding on to this, Dr. McAddy states that the doctor performing this procedure does so without the benefit of seeing the uterus. As the instruments are introduced into the uterus, the possibility of perforation or tearing arises. During late-term abortions, as the fetus gets larger, the uterus is thinner, surgery may become necessary to close the tear. In extreme case, may have to be removed. So not only does the procedure invade the uterus, but it may need to be removed. Thank you.